you know that there's over 150 type of headaches? Well, today I want to talk about one of the types of headaches that probably is the most common. And these are called tension type headaches. Hello, I'm Dr. Michael Gorman. I'm a physical therapist and I'm the founder of iMove TelePT. Headaches affect nearly all of us. In fact, over 80% of Americans have tension type headaches. Tension type headaches can come about from either muscle tension and muscles of the back of the neck, poor posture, poor diet, elevated stress levels. So there isn't just one cause for tension type headaches. Normally there's two or three causes that tend to bring them on. However, if you do have headaches, I want you to know that there are options for you. First of all, you got to get proper rest. If you are sleeping in the range of 3 to 4 to 5 hours a week, majority of people, that is just not enough. Personally, I get about 6 hours of sleep a night, and I know that's probably not enough, but for me, it seems to work. Recommendation is typically 7 to 8 hours of sleep a night. Sleeping is what allows our bodies to rest and recover. Next thing you can do to help yourself if you have tension type headaches is improve your posture. The head weighs between 10 to 12 pounds, but that 10 to 12 pounds is only when you're sitting with ideal erect posture. As we know, so many of us, well, I don't know of anyone that is not on their phone a good chunk of their day or on their computer. If our head starts to drift forward as we're on our phone, on our computer, all of a sudden that 10 to 12 pounds that our head weighs becomes 20, 30, 40, all the way, if your head is all the way forward and you're really looking down at your phone, your head can weigh up to 60 pounds. So that puts a lot of stress on the muscles of the back of your neck. So improve your posture. The third thing you can do to help yourself is if your symptoms get to the point to where they're becoming more chronic and it's affecting your daily activities, please seek out an expert physical therapist. I do recommend going to your primary care physician first when you have headaches, just to make sure that this is truly a tension type headache and nothing else is going on. I hate saying this, but there are people that have had headaches and thought they've had headaches, and unfortunately, the headache was actually a tumor. So that is why before you seek treatment, I always encourage you to go see your primary care physician first. At least call them, let them know of your symptoms, and then they can order the appropriate test. However, the majority of the time, this is going to be a tension type headache. So that is when you need to seek out an expert physical therapist. And the expert physical therapist should be performing some type of manual intervention on you. When I say manual therapy, I mean soft tissue and joint mobilization to decrease pain and to restore range of motion and strength to muscles and joints that have become dysfunctional. It shouldn't be your entire treatment, but manual therapy should be a component of it. Now, during this global pandemic time, I realize that a lot of patients are unable to either have transportation to make it to a clinic or they just don't want to. If that is you, I have a solution for you. I have created videos that will help you to treat yourself at home. Now, you do need the help from either a spouse, a partner, a friend, but I have created videos, and I'm thinking of two videos right now that will help you immensely if you have tension type headaches. If you want those, I will email you these two videos. Just put down below, just type in video, and I'll get those to you. So let's recap what we talked about today. We talked about tension type headaches. 3 potential causes. First of all, muscle tension. Muscle tension, the muscles in the back of the neck. Secondly is not getting enough sleep, not getting enough rest. And the third was poor posture. So keeping that in mind, 3 potential things you can do to help yourself. First of all, start getting rest. You got to get enough sleep at night. Secondly, work on improving your posture. Keep that 10-pound bowling ball on top of your shoulders, on top of your spine. Keep it weighing 10 pounds and not 20, 30, 40, 60 pounds when the head is forward. And third, if the headaches do get bad enough or they become more chronic, more constant, I do recommend that you contact your primary care physician and let them take a first look at it. Pretty good chance this is going to be muscle type tension only, and so you need to seek out an expert physical therapist. And one more thing, if you want to have the 2 videos that I've created that you can help yourself with your headaches at home, just below type video and I'll get that to you. Have a great night, and I hope to see you soon.